Thank you very much. Thank you also very much for being here and for all of your efforts to finally bring us to that moment where we have an opportunity to change healthcare in this nation, to provide everybody in this country with coverage, so that never again do they have to live in fear about what their healthcare status will be, that of their families, of their children, with respect to what happens to them with their employment or their access to health care. Over a month ago, I was having a town hall meeting in Pittsburgh, reporting from Washington to many of my constituents from the Pittsburgh area, and a group of young students came and organizers from Cisco and made a presentation in the form of a long question about health care. And then they wanted to know if I would come and attend a meeting to answer questions and to make a presentation on health care. And I said, you put it together and I'll be here. Well, here we are today. So thank you very much for putting this together. And thank you to all of you. I'm going to take 1 minute here because, as I understand it, presentations are going to be made, and then I'll respond to those presentations and provide an update in Washington. But it's so clear now on its face, I think, to people almost in every social economic strata of this nation, because of what's happened to the economy, because of the financial scandals that imploded our financial system here and around the world. People now realize, no matter where you are working, that employer-based health care is a great idea until you lose your employer, and then you're stuck. And we now see that, and even before the economic downturn, we see that the number one cause of bankruptcies is a lack of health insurance and a medical incident that takes place in our own county now, as we see unemployment continue to rise, as we see the economy continuing to drop, as we see people entering into financial problems because of their homes and loss of insurance. What we see is now people are searching for a place so that their kids can get medical care, so they can get medical care, so their spouse can get medical care. Dr. William Walker is here, and he can tell you of the hundreds of people, especially when we had the influenza, who were without any medical home, who were without medical care, who came to the public facilities and to some private facilities to try to see whether or not they were sick. Were they sick with the influenza, or weren't they? Thousands of people who were just insured a month, 2 months, 3 months, 4 months ago, now without any insurance. So it's not that the uninsured people in this country are free. Very often when we get into this debate, they want to say, well, it's going to cost you so much to include these people in the system. The fact of the matter is they're in the system. They're in the system because we take care of them. Our goal, President Obama's goal, what he's been pushing so hard for, is that we finally make sure that every American who seeks and wants health insurance will have it, it'll be accessible to them, and it will be affordable. One of the key points. That's the goal. We also want to increase the resources of nurses, nurse practitioners, family medical physicians, general practitioners, so we can be able to see people and to do that. But really, this is what it's about. It's about you organizing. It's about you putting pressure on me, putting pressure on other members of Congress, writing to your senators, telling them that we must have a universal system, it must be accessible, it must be affordable, and it must have a public plan in it so we can keep the insurance companies on. Thank you so much for being here. I'll get back to you in a little bit, but I want to leave time for the presentations. Father Cunningham, thank you so much for giving us this space to meet with the community. Thank you.